Hello and welcome again to Rehealth here in Cancun. We're joined by the lovely and very talented Dr. Carrie Bordinko, who is an internal medicine practitioner specializing in concierge medicine. Has uber demand right now, right? So it's very, very difficult to get a consultation with her. We're really doing some amazing things in the precision healthcare space.
Thank you.
So interesting. You're in a unique position because you first came to us as a patient.
I did.
And then eventually as a referring practitioner. So before we go into the treatment stuff, talk to me a little bit about how your experience starting as a patient was.
Okay. Yeah, absolutely. I was introduced to Rehealth by one of my clients who had been coming here for several years. And he'd also gone to some other stem cell clinics in different countries, but eventually landed at Rehealth and found that was a better experience for him. So he invited me down really as an education process. He just wanted me to understand why he made this choice and what he was getting out of it. Multiple family members and multiple friends of his had also experienced Rehealth. So I came down, very inquiring minds, want to know more, something that we don't really get as part of our internal medicine training in the U.S. So I knew a little bit about it. I had been exposed to what we call stem cells in the United States, which I soon learned were very different from what you get when you leave the country. And I was offered the opportunity on that trip to actually experience it myself. So I was very interested. I did that. I kind of have always been a pioneer in if I ask my clients to do something, I like to know what they're going to experience first. I like to test the water.
Guinea pig yourself.
Guinea pig myself. It's a good way to go. So I did that. And I immediately noticed an improvement in my general health, which I always thought I was in very good health to begin with. So I think raising that bar is kind of hard to do. And it was very obvious that it did it immediately.
Right. Because most people go from 0 to 1, where it's easy to see the improvement. In your case, you were at 95, 96 to go
exactly.
Up to 90. Yeah.
Yeah. And I was making that small marginal gain, but it was a gain that I had struggled to make. I felt like I did everything right. I exercise 6 days a week. I eat everything right. I don't have any chronic medical illness. So I thought, okay, what am I really going to get out of this? And I was able to measure what I got out of it. And because of that, I have now come back, and this is my 4th time, and everybody says, why would a healthy person keep going back? And I said, because every single time I do, I notice something improved in my health metrics. And I guess now I've become somewhat obsessed with, trying to get as close to perfection as I can.
For a practitioner, because obviously you understand cellular therapy at a way higher level than most patients
Correct.
do. So being able to, as selective as you are, you like to try everything first, having gone through that, then what made you feel confident to just open it up to your exclusive patient database?
Well, I really felt comfortable with the vetting process, that it was a safe therapy, that I was not putting anyone in any harm's way for any reason. And so learning more from Raphael as well about the differences between the different cell therapies that can be offered, because it's not all just one type of therapy,
correct.
which we've explored all the options now. But understanding the specific diagnoses that I would be targeting with my clients and who could come down and benefit. Also, it's not for everyone.
Right.
And I want to be able to guide people in a choice with their healthcare that is specific, that they will get, I always call it the ROI, the return on investment. If you come down and you invest in using the products at Rehealth, are you going to be able to walk away and say, I really gained something that moved the needle for me?
Right.
And it doesn't work for everyone. As many people as I've sent down, I've told people, this isn't for you. It's not going to help you where you're at. And we always talk about, even with the doctors here at Rehealth, we talk about the preparatory phase for someone coming down. They have to make certain life changes and choices before they come down to get the benefit. But then I felt very comfortable with the technology that's offered here and offering it back to my clients without any reserve at all.
Right. And I think you touched on 2 very important points. One is setting the right expectation, right? Where it's not necessarily for everybody. And then also understanding the personalized precision approach, because you receive, all your patients have a variety of different health conditions. So it's being able to send them down to assure that what they're looking to get addressed will be addressed.
Right. I really work very hard at managing expectations because it's a success story for the patient. It's a success story for Rehealth. If I do that, everyone's going to walk away with a slightly different uptake in their health. And I do my best from knowing the technology to anticipate and walk them through what they should experience. And it is different. It's so variable what everybody gets out of it. I think we're getting slightly more precise in helping people understand with different disease processes what they should expect,
Right.
but it's still highly variable.
And would you say by now, since all your patient database and how you built your practice, that you're first coaching the patient to make the lifestyle change? If they're not willing to do that, then it makes your job harder, correct?
It does. It makes it a lot harder. And once again, because I think that is a failure that none of us want to see.
Right.
And we certainly don't want a patient to spend money when they're not going to get a benefit. If they're not willing to look at that lifestyle issue that may impede the cells from actually benefiting them, then we pretty much tell them the timing right now isn't right, maybe at a later date when they're more open to lifestyle changes. But we work at our wellness center of giving them all the tools around them immediately available to work with the nutrition aspect, to work with the exercise physiology aspect, bringing those to the table first, because we know that after the cells are implanted here, they're going to need to come back and really follow through on
Right.
some good lifestyle. And so we try and get them introduced before they come down.
Right. And also it's important, I think, to clear the ground, make sure that you're minimizing or eliminating as much of the toxins. So we're putting the fertilizer in,
Yeah.
the ground is in better.
And really trying to decrease the inflammation
Right.
before they come down as well.
Obviously, she's explained how important it is to make that decision to send her patients here and set the right expectations. So now what I want to understand from you, Dr. Bordinko, is tell me a little bit about the patient experience, and then why you've decided to refer patients here in the team.
The experience has been just nothing but 5 stars all the way, probably 10 stars and be more realistic. But everyone who comes down, for me, I'm about my brand.
Right.
We have a very strong reputation in our area in Arizona, and we need to extend that. We need to have that same representation for any outside product that we refer out to. And what has been wonderful about Rehealth is every person, there's some intrepidation sometimes about going out of country and getting a medical procedure, especially if they're not frequent travelers out of country. And every person comes back. I actually literally get hugs in the lobby from people saying that was the best experience. That staff is amazing. I felt comfortable the whole time. I felt safe the whole time. I felt like the medical care was probably better than I'm getting in the US right now, which is a great statement. I love hearing that. And it's consistent. It's not, that's a rarity. That's every single person who comes back tells me the same thing. And many of my clients have made the options over the last couple years to make Rehealth part of an annual journey, because they do get the benefit and they really want to continue that same benefit. So they come down and now they're part of the Rehealth family as well. And their friends are part of the Rehealth family. So it's just exponential. But the experience is top notch. That I have no words of improvement that I can even offer the staff. Everybody is wonderful. And it's kind of interesting. A lot of the flow that is at Rehealth is the same flow that we have through our center. So there's a lot of similarity between our companies. It's really easy to decide to refer patients down here because every single time I do, they come back with nothing but praise for the staff, the organization, and how well they were treated. Many times the patients will tell me that they feel like the medical care they received here exceeds what they're able to get in the US right now. And that's a wonderful comment. It's a testimonial to how hard the staff works to make it a good experience, to make it, everyone feels safe and welcome when they come. And for us, there's nothing that I can offer the staff to say, I wish something was done better. It's done perfect every single time.
And I think you touched on a good point. Well, first of all, thank you for recognizing your team. Obviously, without the team, none of this would be possible, right? We could have the best science with Dr. Gonzalez, the best product, but ultimately, if there's not a team that handles this from beginning to end, the process, the experience, and the outcomes probably won't be as much. And maybe you get them to come down once, but it wouldn't be, like you said before, that repetition and the ongoing. No different like you go skiing once a year, and Aspen, this is an important part of your
Right. They come down year after year to experience, like you said, the benefit they get from the actual cell therapy, but also just the warmth that they get from the team and the security they feel when they're here getting medical care.
And I heard someone gave me a really good analogy, which is, a good friend who's in the space. He's like, people know more about their balance sheets and their income statements, more detailed than they do about their own personalized health. And so if we have that level of involvement, obviously on the business side, it definitely has to transcend and move into the health side, because ultimately it's going to allow everything to be done.
Well, and yeah, in the world of concierge and wellness, we always say, your most valuable asset is your health.
Right.
And like you said, but their asset sheet is something they know better. And that's unfortunate. I think people are changing. I think they're realizing money cannot buy health.
Mm-hmm.
You have to invest in your health, and you have to invest proactively.
Correct.
Not, our system is built on a reactive cause and effect type system, and we'll let you get the disease, and then we'll try and backpedal and get you out of it. And we know now that prevention is really the way to go, but prevention is investment. And
Right.
This is the investment aspect of the prevention.
Correct. And I think a lot of times you'll see, like before, you may post a picture of you getting an IV, and then immediately everyone's like, well, what's going on? What's wrong? And it's no, there's nothing wrong.
It's prevention.
It's prevention.
Yeah.
Exactly. So that's part of us as pioneers kind of shifting the paradigm to understanding, like, let's get the message out. Let's get people in to see their doctors before things become chronic, because you know how difficult it is to overcome some of these chronic conditions, and many of them there is no
overcoming,
Right.
and there is no getting back out of that hole that you
Right.
dug for yourself. And the expense, honestly, I don't even think we talk about half the time what the expense is to deal with it after it's occurred.
Right.
And we look at prevention and saying, do I really want to allocate the funds in that area? But it ends up paying so many times over on the investment side.
Right.
Yeah.
Yeah, and I mean, even like you see sometimes, with cancer treatment, I was surprised to see this number. The average out-of-pocket expense for someone with cancer is about $150,000.
Exactly.
And you're thinking, oh, I have insurance, I'll cover that. Well, no, you won't. I mean, to a degree, you won't.
You won't.
And that'll take people into bankruptcy within years upon getting that diagnosis. So by presenting, and that's one of the things that we do here very well, that you've had some experience with, which is dendritic cell treatments.
Yes.
I think that's something that's huge. We have multiple clinical trials going on with the dendritic cells. I'll let Dr. Gonzalez talk a little bit about that in a second. But just the fact that if we're able to diagnose and get someone here earlier, the beauty and the outcome and the chances of success with the dendritic cell vaccine is so much better.
Well, obviously, I started my experience really with the umbilical cord tissue stem, as most people call it, stem cell therapy, but quickly learned more, gained more knowledge in the areas of oncology and NK cells and dendritic cells, and have been able to utilize that technology with that portion of my client base that unfortunately develops a cancer diagnosis.
Right.
And then they're forced to make decisions between traditional medicine in the US market, and maybe they're still making a step forward in traditional medicine. They're going to undergo chemotherapy and radiation, but they still want to know, what else can I do to mitigate the collateral damage from these very caustic treatments that we have available. So then working with Dr. Gonzalez side by side on identifying NK cells and dendritic cell candidates, because that does fall a little bit outside of my area of expertise. And unfortunately, we aren't able currently to lean on oncology in the US to give us a lot of guidance, unless you're working with a center of excellence who may be doing a current clinical trial, which is very limited. So we try and identify those patients. Then I usually call Dr. Gonzalez. He meets or will talk directly with the client and say if it makes sense or not. We've had candidates that were good candidates. We've had candidates that have had to be turned away because there was no actual benefit to them to undergo that form of treatment based on where they were in cancer. And what, I have the utmost respect for with Rehealth is that Dr. Gonzalez and his team, working also with Dr. Ortiz, we'll tell a client, we wish we could help you, but this therapy is not going to make a difference for you in your journey right now. And they don't just bring them down and give them false hopes. And I think that is just so respectable. And so I lean heavily on the clinical team here to make that decision for the patient.
Right. And when the patient's health is the outcome, then, you adjust the expectations accordingly. So just to recap, here at Rehealth, we have a variety of cellular therapies that we offer. So it's the stem cells, as Dr. Bordinko said, the NK cells, which are your natural killer cells, as well as dendritic cells and exosomes. So I'm going to turn it over now to Dr. Gonzalez so he can take you into the science a little bit more, highlighting the benefits of each of these therapies and a little bit of the science.
We're essentially a cell therapy company that has studied cell for many, many, many years. First and foremost, spending time studying regenerative medicine sector, understanding what is the best stem cell source, looking at, people here, the bone marrow, the fat, the different derivatives of different post-birth tissues. We studied and found that this particular umbilical cord is not even so much about the umbilical cord, but it's the method of the way we grow it, and the parameters of when to use it is what we spend years, dating back from a publication in 2010. If you think of the amount of science before you even publish a paper, it's easily 2-3 years of studying. So now we're going back dating to 2008, around there. And we found that particular cell to be optimal, understanding that every cell in your body has a specific function, does something different. We were really eager when a publication came out, actually back in 2010, looking at what transpires in the body when we look at a full regenerative effect. And it was basically a mouse model that is an aged mouse model, and that aged mouse was given a transfusion of blood directly from a young mouse to this aged mouse model that was no muscles, no hair, couldn't walk the maze the right way. And then what they noticed, that mouse is a senescent mouse model, which is essentially a zombie cell that just occupies space, does nothing. And when they did that transfusion, the senescence was removed, all these age-old cells were removed, and the body itself has its natural capacity to heal. But if the signals are not there, it's not going to happen. And since all these cells were eliminated when that blood transfusion was happening, they noticed that the young blood removed the old senescence. That mouse then grew hair, grew muscle, was able to walk the maze. From there, we said, what is no better of a cell that does this, that is in the cancer sector already, is the natural killer cell. The immediate responder in your body that works on removing a virus, a cancerous cell, and that zombie cell that occupies space, causes havoc, makes you older, because those old cells, all they do is cause more havoc, signals release, and causing that. So we went into the NK cell sector, spent years developing methodologies of how do we take a cell, this NK cell, from you? So true precision medicine. How do we take it from you? How do we activate it? And then you normally walk around with 1 billion to 2 billion of them, but the majority of them, as you age, become senescent. That's why you're more prone to get cancer. That's why you're more prone to have health issues. How do we take those and activate them, sort of bring them to a younger state, and then expand them to that parameter of 2, 3 billion, 4 billion now in some cases, and then infuse them back in, and what transpires. We published a paper a little bit over a year and a half ago, that actually shows you that we can actually remove that aged immune system from you, looking at 2 key parameters of it. Not only that, when you do that, secondarily, we saw that we can even control inflammation, the inflammatory response. So now we have that stem cell tool that does that, controls that inflammatory response. And then we have that other NK tool that actually helps remove those age-old cells to help your own system regenerate, your own system do the right thing in the context of the immune system. One of the other issues that we just talked about was cancer. You're more prone to get cancer as you age. Now, a lot of people do not even know when you tell them what's a dendritic cell. This guy is essentially he's essentially the conductor of the full military of your immune system. It's a cell that's floating around, and when a virus comes in, it'll pick it up, chew it up, and present it to your immune system, your T cells, to basically say, go out, attack, kill, make clones of yourself, build that full infantry, come back and kill this as you recognize it. Unfortunately, cancer is something that's consistently hidden. The immune system is weak as we age. It doesn't recognize anything. If we can take a piece of that tumor, here we go again with what we do, what we specialize in, precision medicine. We can take a piece of that tumor, we can now break that up, we can isolate the protein, we can isolate the DNA, we can then load it into a technology that's actually out of US-based company, load it into where they actually have clinical studies for the worst cancers you can think of, glioblastoma and pancreatic cancer. You can load it back in there, and you can now prime the immune system to say, look at this immune system. I need you to build that army for me. Go out and attack it and go get it. And we've done it well.
I would say the biggest part is I think people assume in the U.S. that we have all this technology, that we're doing this every day. We must be delivering the best there is in care. And what you quickly find out is that some of this technology is not being offered. It's certainly not ever covered by insurance, but even just not offered is the bigger problem.
Right.
And so to capture more precision care, which is what we want to do, we have to go out of country. And then then the big question, where do you go? Is it safe? How valid is it? Those are all the things that we have to vet. And we've found that at Rehealth that absolutely has all been taken into consideration. The technology, like you said, is coming out of the US. We're just deploying it. We're just deploying it in a different location because we can.
Right.
And offering people a very close proximity. For so many places, this isn't a very far jaunt to get down to.
Not at all.
That they can come down here, receive the care, receive the full medical care while they're here. Anything they need can be covered while they're here, and then return back home and still have the continuation of their oncology care. It doesn't disrupt their current oncology care either. And we're getting more receptive to some of the doctors in the U.S. that understand that this is a emerging technology not available. So actually some of the centers of excellence are saying, if you have the bandwidth, if you have the capability to go somewhere and receive that and then come back and let us do what we do, they're actually becoming more supportive.
And now many times it's actually just an adjuvant to what you're actually doing already in the US. So
exactly.
You're doing chemo, continue with your chemo, figure a way to actually work this in, and we can work it in. And working with your oncologist at home, that we can actually do this.
Yeah, because even if in a traditional chemo approach, you're still not addressing the immune system, right? You're always going to have to support the immune system on this, because you're going to be even further depleted. So if we're providing additional therapies to kind of help the immune system hold up better, I think it also could help improve the chances of the success of that.
Absolutely, yeah.
So I think that it's really amazing. Congratulations for all the great work that you're doing. If we had more Dr. Carrie Bordinkos around, I think we'd all be in a better place and a lot healthier people. So great to continue to work with you and hope we could keep expanding what we could offer you and your patients. So thanks again for coming down.
Thank you guys.
Right.
Appreciate it.
Thank you.
Awesome. So just to recap, if you heard, this was a great session today. You really have two of the pioneers in the space, and cell therapy, precision medicine with Dr. Bordinko and Dr. Gonzalez. So if you want to find out more, or if you want to book a consultation with one of our physicians, please click on the link or reach us directly for more information. Thank you.